us
Thank you.
today. Thank you. Next, we will have testimony from Ryan Hampton. He is an author and an advocate for addiction recovery policy reform. Thank you for joining us, Mr. Hampton.
Thank you, Madam Chair, and thank you to the members of the committee for inviting me here this evening. I'm grateful to be here. 5.5 years ago, I was homeless, hopelessly addicted to heroin, and desperate for help. I knocked on every single door in my community, going from facility to try and find treatment. I put my name on waiting lists that seemed like they stretched for years, went to recovery support groups, and just tried to hang on. Finally, I was given a chance by a facility that actually accepted Medicaid. And I can honestly tell you this evening that if it weren't for Medicaid, I probably would be dead today. In the last couple of years, I have lost dozens of friends, people I loved in my community, who were as desperate, as motivated, and as driven to seek help as I was. They died of preventable overdoses because our healthcare system failed them. I did survive, and I'm here to tell you that if we are to restore the soul of our country, we must make addiction and mental health a priority in this platform. Survival should never be a matter of luck. It should be an opportunity that is extended to every person who wants it the moment they seek help. Access to life-saving recovery support services, treatment, and harm reduction are largely built from community-based efforts such as peer supports and recovery community organizations. Instead of massive investments into the community systems and healthcare supports that saved my life and are backed by well-supported evidence, our communities are experiencing rollbacks, setbacks, and an increase in overdose deaths. The Trump administration's repeated efforts to repeal the Affordable Care Act results in deaths of people just like me and just like my friends. When I see the administration's repeated attacks on healthcare, I think that could have been me. I lived because I was lucky, but more than 350 people die every single day in this country due to drugs and alcohol. Now, I'm not here to put myself forward, but to call your attention to the crisis that was already claiming hundreds of thousands of lives before we were hit by COVID-19, and that is the drug epidemic in this country. We are now fighting on two fronts. Coronavirus and addiction combined are a deadly force. Experts are already predicting that we face losing another 70,000 people to overdose and suicide just this year alone related to COVID. At the same time, isolation, fear, and hopelessness place people with substance use disorder at increased risk. As the various arms of our healthcare system are completely overwhelmed and overburdened, now more than ever, it is incredibly apparent that we need a new deal to support addiction and mental health recovery in this country, and we need it fast. Our party's platform must address the many social determinants of health that ultimately lead to substance use disorder. We must prioritize long-term recovery support services, evidence-based treatment, prevention, and harm reduction services that are proven to work and curb overdose deaths. We can get ahead of the curve by listening to, supporting, and investing in the thousands upon thousands of frontline providers and organizations that have spent decades building trust in their own communities. Prioritizing policy developed with evidence and in collaboration with people with lived experience in recovery, effective criminal justice reform, increasing health equity for all communities, expanding the peer recovery workforce, and finally, enforcing the Mental Health and Addiction Parity Act of 2008. I believe that we can accomplish all of this. Together, we can indeed restore the soul of our nation. But to have a soul, you have got to have a heart. And that means action, not just political platitudes from day one of a new administration and a new Congress that finally offers robust solutions to save lives and end this overdose crisis once and for all. Thank you.
Thank you. Our first question is from Secretary Vilsack.
Thanks, Mayor. Ryan, thank you very, very much for bringing a very critical issue before this committee. It's one that I have some personal involvement with. My mom suffered from alcoholism and prescription drug addiction, and I know the pain, I know the challenge, and I know that the help needs to be there when the individual is ready, willing, and able to take a step towards recovery. I wonder if you could take a minute of your time and our time tonight to share with us how addiction impacts families and communities. I think sometimes we focus obviously on those who are addicted, but there's a much larger set of people impacted and affected by addiction. And perhaps you could give us a bit of insight about family and community.
Yes, thank you for the question, Mr. Secretary. I mean, as they say, addiction impacts not just the family, it impacts the entire community. I always drive back on my own experience as a person who was needing help for well over a decade. My mother, my sisters, my friends, we were completely isolated. Part of the problem, though, was that when I was ready to ask for help, qualified help wasn't there ready to receive me as a patient. The community supports were not in place, not only to not support me as someone who needed help, but also to support my family. We need to create an infrastructure that isn't just providing treatment, acute treatment to the person who needs it right away, but recovery support services that support the family as a whole. I will tell you that my family, we experienced so much as a family unit together that was negative while I was using and while I was seeking help. But once I was able, and again, I would like to say it was by a stroke of luck. I am not sitting here today because the system worked. I am sitting here because I was lucky, right? Because I was able to make it into recovery, though, my family has also recovered as well. My mother could have used support services and people, mentors, a peer mentorship model, just like I had when I was in early recovery, and that was not available to her on a qualified basis. So when we address substance use disorder, we cannot leave out the family systems that are so important to the holistic approach to combating the overdose crisis.
Well said. Thank you very, very much.
Thank you.
Thank you. Congresswoman Clark has a question.
Thank you so much, Madam Mayor, and thank you, Brian, for joining us and for your powerful personal testimony. I think when people like you come forward and tell their story of recovery, it helps us reduce the stigma around seeking mental health treatment and substance use disorder treatment. And I wonder if you could talk a little bit about that. And I also would like your comments on what federal programs we could implement that could make the most impactful change and provide the most relief for people struggling with addiction.
Thank you, Congresswoman, for the question. Some people do use the word stigma. It is stigma, but I would go a step further. For many of the friends of mine who actually were in the process of seeking help and were denied help, some of them at healthcare facilities and large hospital settings because they were labeled as an addict or as a junkie. They were seen as second, third, fourth class citizens of this country. I would go as far to say that it isn't just stigma, it's discrimination. It is prejudice against people who use drugs. It is prejudice against people who are in recovery. I know many people who are in long-term recovery today who have issues with accessing employment, who have issues with accessing housing, basic needs because of their recovery status. So at a certain level, it goes beyond stigma and becomes discrimination. To combat that, though, on a positive note, I'd like to quote actually a former drug czar who actually served under many Republican administrations and has worked with many Democrats as well. His name's Dr. Robert DuPont. He served 17 White House drug czars and 14 heads of the DEA. Dr. DuPont recently said, and I quote, There's a lot of discouragement in our field and a lot of frustration, but there's one thing that's still growing, and that is the recovery movement. That's our answer, Dr. DuPont said. 25 million strong and growing. We can look to that community for what to do and how they're doing it. I believe the more people like myself and my community and others who have been impacted by substance use disorder, the more that we step up and not just tell our stories, but get involved in the Democratic platform, get involved in our local communities, let people know what recovery is and what it looks like. We can shatter that discrimination. We can shatter those biases against people who are currently struggling and people who are in long-term recovery. Regarding your question on the federal level, what I would suggest and hope is we have seen some federal investment. The Trump administration likes to claim big victories on the opioid crisis. This is way bigger than an opioid crisis. We have an addiction and mental health crisis. Right now in the Western states, I'm in my state of Nevada, we are seeing more overdose deaths due to methamphetamine than we are opioids. We need to be looking at all drugs, including alcohol. So federal funding that comes down needs to be inclusive of all substances and not just opioids, because the next drug crisis is right around the corner if we don't address it that way. Secondly, I would say there has been while the focus on treatment is incredibly important, the focus on evidence-based care when it comes to treatment and prevention is incredibly important. Because of that, we have not seen the type of investments that we need in long-term recovery supports. So I had been to treatment well over half a dozen times. I was never able to sustain my recovery and came close to death and overdose multiple times. What we need is an investment in the infrastructure, a recovery-oriented system of care that gets people past those first couple of years and past that fifth year. Surgeon General Vivek Murthy, under President Obama, issued the first ever Surgeon General's report on addiction, alcohol, and drugs called Facing Addiction in America. That report stated that if we can get someone past 5 years, they have an 85% chance at sustaining their recovery for the rest of their lives. That report now has been sitting, I'm convinced, on some bookshelf in Health and Human Services, just collecting dust, because we are doing very little that was recommended to the federal government in 2016. The answer is in that report. The answer is in investing in those long-term recovery supports and making recovery real, attainable, and sustainable for every single American that desires it.
Thank you, Ryan. Thank you for living Dr. DuPont's call to action. We really appreciate your testimony.
Thank you, Congresswoman.
Thank you so much for joining us. And I'm going to assume that report is next to the pandemic handbook that was left behind as well. So thank you.